Ontario has flattened the fourth wave. That is according to the Science Advisory Table, which released the new modelling today. It's in sharp contrast to the last modelling 4 weeks ago that concluded in a worst-case scenario there could be 4,000 cases a day by now. This province has definitely been in the best-case scenario.
We are doing well. We are doing better than I thought we would be at the end of September, but we're not out of the woods yet.
The science table concludes what the daily data has been showing us. Cases, hospitalizations, and ICU admissions are holding steady.
It looks cautiously optimistic.
No, you're reading it correctly. Absolutely.
However, there is a but. The table emphasizes public health measures work and need to stay in place.
If you want to see what the worst case scenario could have looked like, just look west to Alberta.
The Science Advisory Table finds daily cases in Ontario could go up to 1,500 by November if the status quo is maintained, and cautions the situation is still fragile due to cold weather coming and people socializing indoors. The fastest number of growing cases are now in the 5 to 11 range. Provincial data shows since August 11, 42% of all cases have been in that age group. Canada is waiting for the approval of the Pfizer vaccine for those children aged 5 to 11. Experts believe it could possibly be administered in young arms by Christmas.
So what we know so far from the data is that it is relatively rare for children to get seriously ill. It does happen importantly. So other countries, for example, the United States, that had big waves of the Delta variant sweep through earlier than we've seen them, did have a very serious rise in children in hospital who are very sick. So it is rare, but when you're talking about hundreds of thousands of children exposed, even if it's rare, you're still going to get an important number of children getting really sick.
The science table also concludes roughly 1 in 10 people who get COVID will experience long COVID. That works out to almost 80,000 people at the highest estimate who could experience symptoms like fatigue, brain fog, shortness of breath for more than 3 months. It warns it could have a long-term impact on the healthcare system. Now, a little more on school-aged children in the numbers. It's been about 3 weeks since schools reopened, and we're starting to see an uptick in the number of infections in our classrooms. 280 new school-related cases are being reported today. That is the second highest daily total we've seen so far this month. 808 of the province's 4,800 schools have at least one active case, with the majority being among students rather than staff.